Hello, I am Dr. Rajasekkhar Pappuu, Orthopedic surgeon from Onus Robotic Hospitals, Champapet. Today we are going to know about fragility fractures of proximal humerus. Why they are fragility fractures? Because they break without much force or trauma. Usually a fracture requires a severe high velocity injuries like road traffic accidents or fall from height. But these fractures do happen even for a simple fall at home. So that's why they are called fragility fractures. Why it is fragile? Because your bone is osteoporotic. It doesn't have much calcium. Why it is having less calcium? Because you have not taken one reason is you have not taken proper vitamin D3, or your hormonal imbalance is there, maybe PTH is high. So because of that also you lose your calcium from the bone. So many reasons are there. Even kidney problems also cause your bone loss. So that's why osteoporosis is very common. So that is why we call these as fragility fractures. So what is the main treatment for these fractures? Simple fractures like two-part undisplaced fractures we don't operate. We just give an arm sling which will heal in 10 days, 15 days. There are some complex fractures also which require just sling treatment. So if it is in position, if it is in acceptable position like 3-part, 4-part fracture, but it is in acceptable position, we can take serial X-rays on 7th day, 12th day. If the position is acceptable, we can always treat them without surgery. Sometimes there will be few fractures where greater tuberosity has displaced much, migrated proximally. These fractures cannot be treated conservatively because even after treating, you might not be able to lift the shoulder up because your greater tuberosity has migrated proximally, because the muscle which has to lift your shoulder is attached to the your greater tuberosity. So that is has already gone up. So there will not be any pulling force in the muscle. In those cases, we have to do a open surgery. Put it back in position, put a plate. So if you are very porotic, we also do sometimes minimally invasive surgeries like Neuro technique. X-fix also we can apply and mobilize you. In shoulder, most important thing is not the reduction on the X-ray. That is, beauty of X-ray is not important for us. Beauty of functional recovery is more important than the beauty of X-ray. So your recovery must be good. You must be able to lift your arm, eat your food properly, take bath, and also scratch your back. That's more important than having a proper X-ray.